Okay, this video is what they don't teach you in medical school. And the way these videos work is I'll just have an idea, like, that seems interesting, and I'll write it on a note card and I'll say, make a video about that. And if it's something I'm really interested, I'll do a bunch of extra reading, or I'll have a conversation with another doctor friend or something, and I'll go, gee, that's interesting, I'll make a video of that. And then I get a free moment and I just crank these things out. So, I like this one right here, what they don't teach you in medical school. I'm going to get all the most important stuff in here, but there's going to be some little details. This is just off the top of my head. I'm remembering this spontaneously. There's going to be subtle, less significant causes of these diseases I mentioned to you. It's just to get the idea of it, because the typical doctor goes through med school and residency totally oblivious to the things I'm about to say. They don't even, most of them aren't even aware what I'm about to say exists. Not all of it, but most of it. And these are like the most common diseases. And so this is really basic stuff, low-hanging fruit. Okay, so stuff you don't learn in medical school. So, there's a tendency to come out of residency and think you really know what you're doing. And I can assure you, it's basically a giant blind spot in the medical mind, is having a basic understanding of nutrition and toxicology. And nutrition and toxicology are what causes most diseases. So most doctors come out of residency and they really don't know that much about disease causation or even treatment of the common causes of disease. It's really easy to learn. You simply have to be aware that these things exist. In your training, you simply didn't get taught, and it's not in your books, nutrition and toxicology. They're real important things. So what causes obesity? The basic issue is too much fat in the diet, high caloric density foods like oils, and then estrogenics, which make the body think it's pregnant, so to speak, affecting the PPAR gamma switch. Omega-6 fats over time gradually cause injury to cells in the hypothalamus, the hunger center, arcuate nucleus. So that's the main causes of obesity. Avoid those things and you probably will be skinny. Okay, all of these rice eaters in Asia, they're all skinny when they're eating most of their calories from white rice. Okay, same thing with other starch-eating plant-based populations. Hypertension, mostly caused by excess dietary fat, also excess dietary sodium. Stress makes it worse. Lack of potassium and magnesium due to lack of eating plants. Caffeine makes it worse. Sleep deprivation is a stress equivalent. Okay, diabetes caused by excess dietary fat. That's what causes insulin resistance. You actually need to know that to take care of these patients. And these problems right here, diabetes, hypertension, and obesity, that's sort of the stepping stones that lead to most severe diseases. Yeah, there's a lot more than that, but that's the big money. That's the majority of the patients. If somebody tells me, you got a 65-year-old patient with cognitive impairment, can you look at his brain MRI? I don't even need to look at the chart. I know that the odds are statistically better than 9 out of 10. This patient will have diabetes, hypertension, cataract, poor dentition, overweight, coronary artery disease, impotence. I mean, those things would just go together. It's like saying one thing. Autoimmune disease, leaky gut's the most important cause to be aware of, especially from dairy, but other causes of meat, fat oils, there's a whole bunch of causes of leaky gut. By the way, I got much more detailed videos about all this stuff on this YouTube channel. Lack of fiber to feed the good gut bacteria, excess sodium, advanced glycation end products, AGEs, possibly F- and GP, probably, I think, but that's another topic for another day. Other causes, yeah, there's other ones. Inflammation, leaky gut again, of course. Postprandial endotoxemia from the meat. Xenocylitis from the meat. Abdominal pressure syndrome causes a whole bunch of things. It's due to lack of dietary fiber. Dennis Burkett figured this stuff out back in the 1960s. Appendicitis, hemorrhoids, varicose veins, hernias, varicocele, hiatal hernia, GERD, gastroesophageal reflux disease, esophageal CA, etc. Lack of fiber. Okay. Interesting, varicose veins there, huh? Dementia. The main thing going on with dementia is a mismatch between metabolic demand of the neuron and oxygen glucose delivery. So I got a whole list of this, Rogers theory of neurodegeneration and dementia, the whole video going through all the details of that, Metabolic demand much higher than oxygen glucose delivery. Neurons go into apoptosis. The whole GLUT4s in the hippocampus, for example, that's interesting stuff. Entire separate videos about all this stuff. Okay, anxiety. I have like a series of lectures on food and mood that can help you, but the bottom line is when you're ramping up the activity of those neurons in the limbic system with increased MSG, aspartame, stress, high-fat diet, that can potentially increase your anxiety. Spine, ischemia, just like ischemia is the main problem everywhere else, it's the main problem in the spine. degenerative disc disease leading to a cascade of DJD, DISH, OPLL, interbody fusion, chalk stick fractures. It all begins with ischemia. F- and GP factor into it by damaging the collagen, making the spine more stiff, leading to fibrosis of the collagen connective tissue. Atherosclerosis. The big thing to know about atherosclerosis is that cholesterol is just a subset. The money is to understand that atherosclerosis is a blood clot. Trust me on that one. I did a fellowship in vascular disease, primarily vascular disease, vascular interventional, at Harvard. I've been interested in atherosclerosis a long time. If you don't know that atherosclerosis is a blood clot, nothing will make sense. Once you understand atherothrombosis theory, you'll start connecting all the dots and understanding a ton of stuff about atherosclerosis. You have to read about hemorrheology. That's what kind of starts the whole process. Stress contributes, TMAO contributes, the different bridging molecules like fibrinogen, IgM, uric acid are all relevant. But the worst one, of course, and the most common one is LDL. Cancer, you learn the genetic theory. The genetic theory has a little bit of benefit, but not that much. The money theory is to understand the Warburg effect, metabolic theory, understand high-fat diet and toxins. When you start going down that path, you'll be able to figure out a lot of things about cancer. And, the reason to know this stuff is help your patients, maybe save your parents' life, help your own health. Breast cancer, you got to learn about estrogenics. It's pretty simple, estrogen metabolism. I got lectures on all this, and I've never met I only met one resident who knew a little bit about it in my whole career. The rest of them all don't know anything about it. So anyways, these are things that are not taught anywhere in med school as far as I'm aware from all the medical students, doctors, and residents I've ever met. So it's easy to learn this stuff. Just being aware of it, all of a sudden you can look at it, watch the videos at my site, study it from other places. You learn all this stuff, and it'll help you be a much better doctor. At least 70% of disease is caused by these things, and doctors don't know it. So it's easy to learn.